Hi friends, welcome to lesson 29, Constitutional Safeguards, National and State Level Welfare Schemes for Women and Children. Introduction. The Constitution of India not only grants equality to women, but also empowers the state to adopt measures of positive discrimination in favor of women for neutralizing the cumulative socio-economic, education and political disadvantages faced by them. Fundamental rights, among others, ensures equality before the law and equal protection of law. It also prohibits discrimination against any citizen on grounds of religion, race, caste, sex or place of birth and guarantees equality of opportunity to all citizens in matters relating to empowerment. For instance, Article 14, 15, Article 15 Clause 3, Article 16, Article 39 Clause A, Article 39 Clause B, Article 39 Clause C and Article 42 of the Constitution are of specific importance in this regard. Objectives of this lesson. After completion of this lesson, you will be able to describe the constitutional safeguards for women and children. You will be able to explain various national and state level schemes for women and children. So, let us begin by discussion on constitutional safeguards for women. Article 14 provides for equality before law for women. Article 15 Clause 1 provides the state not to discriminate against any citizen on grounds only of religion, race, caste, sex, place of birth or any of them. Article 15 Clause 3 provides the state to make any special provision in favor of women and children. Similarly, Article 16 provides for the equality of opportunity for all citizens in matters relating to employment or appointment to any office under the state. The state, to direct its policy towards securing for men and women equally the right to an adequate means of livelihood, that is Article 39 Clause A, and equal pay for equal work for both men and women, which is part of Article 39 Clause D. Article 39A promotes justice on a basis of equal opportunity and to provide free legal aid by suitable legislation or scheme or in any other way to ensure that opportunities for securing justice are not denied to any citizen by reason of economic or other disabilities. Similarly, Article 42 provides the state to make provision for securing just and humane conditions of work and for maternity relief. Article 46, it provides the state to promote with special care the educational and economic interests of the weaker sections of the people and to protect them from social injustice and all forms of exploitation. Article 47 provides that the state to raise the level of nutrition and the standard of living of its people. Article 51A promotes harmony and the spirit of common brotherhood among all people of India and to renounce practices derogatory to dignity of women. Article 243D(3) provides that not less than 1/3, including the number of seats reserved for women belonging to scheduled castes and scheduled tribes, of the total number of seats to be filled by direct election in every panchayat to be reserved for women, and such seats to be allotted by rotation to different constituencies in a panchayat. Article 243(d)(4) provides not less than 1/3 of the total number of offices of the chairpersons in the panchayats at each level to be reserved for women. Article 243(t)(3) provides that not less than 1/3, including the number of seats reserved for women belonging to the scheduled castes and scheduled tribes, of the total number of seats to be filled by direct election in every municipality to be reserved for women, and such seats to be allotted by rotation to different constituencies in a municipality. Similarly, Article 243(t)(4) provides for reservation of offices of chairpersons in municipalities for the scheduled castes, scheduled tribes and women in such manner as the legislature of a state may by law provide. Indian Constitution is also very sensitive and provides constitutional safeguards for children. In fact, there are number of articles that address various needs of children, which can be divided into fundamental rights and directive principles of state policy. Fundamental rights are justifiable in a court of law and are negatives that prohibit the states from doing things. The courts are bound to declare a law as invalid if it violates a fundamental right. Directive principles are positive suggestions for states and are not justifiable in a court of law. Fundamental rights, let us now have a discussion on this. For instance, Article 14 states that the state shall not deny to any person equality before the law or equal protection of laws within the territory of India. Article 15 says that the state shall not discriminate against any citizen. Nothing in this article shall prevent the state from making any special provisions for women and children. Article 21 states that no person shall be deprived of his life or personal liberty except according to the procedure established by law. Article 21A states, the state shall provide free and compulsory education to all children of the age of 6 to 14 years in such a manner as the state may by law determine. Article 23 states that traffic in human beings and beggary and other forms of forced labor are prohibited, and any contravention in this provision is an offence in accordance with law. Article 24 states that no child below the age of 14 years shall be employed to work in any factory or mine or be engaged in any other hazardous employment. The Constitution 86th Amendment Act was notified on 13th December 2002, making free and compulsory education a fundamental right for all children in the age group of 6 to 14 years. When we talk about directive principles, which is part 4 of the Constitution of India between Article 36 and 51, contains the directive principles of state policy. Article 39E and F provides that the state shall in particular direct its policy towards securing to ensure that health and strength of workers, men and women, and the tender age of children are not abused, and that the citizens are not forced by economic necessity to enter a vocation which is unsuited to their age or strength, and that children are given opportunities and facilities to develop in a healthy manner and in conditions of freedom and dignity, and that the childhood and youth are protected against exploitation and against moral and material abandonment. The Article 45 states, the state shall endeavour to provide early childhood care and education, that is ECCE, for all children until they complete the age of 6 years. Article 47 states that the state shall regard the raising of the level of nutrition and the standard of living of its people and the improvement of public health as among its primary duties. Article 243G along with Schedule 11 provide for institutionalization of child care by seeking to entrust programs of women and child development to Panchayat, which is item 25 of Schedule 11, apart from education, which is item 17, family welfare, which is item 25, health and sanitation, which is item 23, and other items with a bearing on the welfare of children. There are several child related legislations and schemes which help in safeguarding the child rights. But now let us first discuss the welfare schemes for women at national level. Pradhan Mantri Matri Vandana Yojana PMMVY, which is a erstwhile maternity benefit program which has been contributing towards better enabling environment by providing cash incentives for improved health and nutrition to pregnant and nursing mothers. Scheme for adolescent girls is there, which aims at girls in the age group of 11 to 18 years to empower and improve their social status through nutrition, life skills, home skills and vocational training. Pradhan Mantri Mahila Shakti Kendra scheme provides community participation through involvement of student volunteers for empowerment of rural women. National Creche scheme to provide daycare facilities to children of age group of 6 months to 6 years of working women who are employed. We also have Rashtriya Mahila Kosh RMK to provide microcredit to poor women for various livelihood support and income generating activities at concessional terms in a client friendly procedure to bring about their socio-economic development. Swadhar Grah to provide relief and rehabilitation to destitute women and women in distress. Ujjwala is a comprehensive scheme for prevention of trafficking and for rescue, rehabilitation, reintegration and repatriation of victims of trafficking for commercial sexual exploitation. Working women hostels for ensuring safe accommodation for women working away from their place of residence is also important welfare scheme. Schemes of one-stop center OSC and women helpline WH are being implemented to facilitate access to an integrated range of services including medical aid, police assistance, legal aid, case management, psychosocial counseling and temporary support services to women affected by violence. We also have gender budgeting scheme which is being implemented as a tool for mainstreaming gender perspective at various stages of planning, budgeting, implementation, impact assessment and revisiting of policy program objectives and allocations. The scheme helps in strengthening of institutional mechanisms and training of various stakeholders so as to mainstream gender concerns in central and state governments. We have a wonderful scheme called as Swavalamban. This scheme provides training and skills to women to enable them to obtain employment or become self-employed. The trades in which training is imparted includes computer programming, medical transcription, electronic assembling, electronics, radio and TV repairs, garment making, handloom weaving, handicrafts, secretarial practice, embroidery and community health. There are also several state level welfare schemes for women initiated by Telangana government. Let us discuss some of them. One of the flagship programs is the KCR Kit. The state government has launched KCR Kit scheme for pregnant women, and pregnant women can utilize the scheme for maximum 2 deliveries. Women who give birth at a government hospital can utilize this scheme, and the main aim of this scheme is to provide all the necessary items for pregnant women and the newborn baby. Under this scheme, pregnant women will be provided with a financial assistance of rupees 12,000 in 3 phases. In case of a baby girl, an additional rupees 1,000 will be given by the government. KCR Kit contains baby oil, soaps useful for mother and child, mosquito net, dresses, handbag, toys for children, diapers, powder, shampoo, saris, towel and napkins along with the baby bed. There is also a scheme called as Kalyan Lakshmi or Shadi Mubarak scheme. To alleviate the financial distress of scheduled caste, scheduled tribe and minority families, government decided to sanction a one-time financial assistance of rupees 1,116,000 at the time of marriage for brides who are residents of Telangana state. Accordingly, Kalyan Lakshmi and Shadi Mubarak schemes have been introduced with effect from October 2nd, 2014 for unmarried girls who have completed 18 years of age at the time of marriage and whose parental income does not exceed rupees 2 lakhs per annum. We also have a wonderful scheme called as Arogya Lakshmi. Telangana government provides one nutritious meal every day to pregnant and lactating women and children below the age of 6 through Anganwadi centers. The scheme was launched on January 1st, 2015. For the women, 200 milliliters of milk for 25 days a month and 1 egg each day will be given along with the meal as part of this scheme. Children aged between 7 months and 3 years are provided with 16 eggs a month in addition to a 2.5 kg food packet. For children aged between 3 and 6 years, 1 egg a day in addition to rice, dal, vegetables and snacks is also supplied. Asra Pension Scheme. It is meant to protect the most vulnerable sections of society, in particular the old and infirm people with HIV/AIDS, widows, incapacitated weavers and toddy tappers who have lost their means of livelihood with growing age in order to support their day-to-day minimum needs required to lead a life of dignity and social security. The Telangana government introduced Asra, a new pension scheme enhancing the monthly pension from rupees 200 to rupees 1000 for the old aged widows, weavers, toddy tappers and AIDS patients, and rupees 500 to rupees 1500 for disabled persons, and from the year 2020 to 2021 the government is providing Asra pension of rupees 2016 to senior citizens, widows, BD workers, filaria victims, single women, handloom weavers, toddy tappers and AIDS victims, and rupees 3016 for disabled pensions. We also have she teams. Keeping the rising incidents of crime against women in mind, the Telangana government has constituted a 7-member committee headed by IAS officer Poonam Malakondayya to advise it on the measures to be taken for the safety and security of women and girls. The committee submitted its report with 77 recommendations. Forming she teams is one of them. The teams keep tab on the eve-teasers and stalkers in crowded places. Initially set up in Hyderabad and Cyberabad Police Commissionerate, they were expanded to all Telangana districts on 1st April following the encouraging results. To encourage entrepreneurship, 𝗧-𝗦𝗔𝗧 Women Entrepreneurs Hub also has been started up as an incubator exclusively for women entrepreneurs. Through 𝗧-Hub aims to support women entrepreneurs with innovative ideas, solutions and entities focusing on emerging areas in technology. 𝗧-Hub also supports underexplored, unexplored sectors along with the service sector. The mandate and goal of 𝗧-Hub is to eliminate financial, societal and support barriers for women and help them succeed in their enterprises. Friends, now let us discuss about national level welfare schemes for child development. Integrated Child Development Services ICDS is being implemented through states and union territories with the aim of holistic development of children up to 6 years of age and to meet the nutritional needs of pregnant women and lactating mothers. The ICDS scheme is a single largest centrally sponsored integrated program to improve the nutritional and health status of children in the age group of 0 to 6 years and to contribute to their psychological, physical and social development. Following services are provided through ICDS: a supplementary nutrition program to 0 to 6 years children, pregnant and lactating mothers, facilities to preschool education to children, immunization, health checkups, referral services, health and nutrition, education to children, women and adolescent girls. We also have Integrated Child Protection Scheme, which is now Child Protection Services, which is being implemented again through the state government and union territory administrations to create a safe and secure environment for overall development of children in need of care and protection in urban and semi-urban areas. National Nutrition Mission NNM. The Government of India has approved setting up of NNM commencing from 2017 to 18. The NNM as an apex body monitors, supervises, fixes targets and guides the nutrition related interventions across the ministries. The program through the targets will strive to reduce the level of stunting, undernutrition, anemia and low birth weight babies. Beti Bachao, Beti Padhao. Launched with an initial funding of ₹100 crores, the scheme aims to address the issue of the declining child sex ratio image and is a national initiative run jointly by Ministry of Women and Child Development, the Ministry of Health and Family Welfare and the Ministry of Human Resource Development, which has now been renamed as Ministry of Education. Beti Bachao, Beti Padhao is a comprehensive program which is being implemented to address the declining child sex ratio and related issues of empowerment of women over a life cycle continuum. We also have Sukanya Samriddhi Yojana. It is part of Beti Bachao Beti Padhao campaign and the program encourages to build a fund for future education and marriage expenses for their female child. Parents can start saving early as the minimum amount of investment required is small and the account is active for 14 years from the date of opening the account. It also has tax benefits and an interest rate of 9.1% and is meant for girls under the age of 10 years. One can start the account with just rupees 1000 and the maximum deposit is rupees 1,50,000 per year. 𝗧𝗦𝗔𝗧 𝗧𝗦𝗔𝗧. This scheme was launched by Government of India on 15th August 1997 and covered all girls born on or after 15th August 1997 who are below the poverty line. It aimed at offering financial aid to girl children born on or after 15th August 1997. The scheme's key objectives include improving the enrollment and retention of the girl child in schools and helping raise daughters until their legal age of marriage. If successful, young girls will get an education that will help them with jobs to generate a steady income. A gift deposit of rupees 500 at birth and second fixed amount deposited every year of school she progresses until class 10. Only one girl child per family can use this scheme. We also have schemes like CBSE Scholarship Scheme, Policy for Girl Education, which is a central government scheme available at government CBSE schools only. It is applicable for one girl child per family across India and aims to supplement the school tuition fees. There is relaxation of rupees 500 per month in school tuition fee. The girl should have scored at least 60% or 6.2 CGPA in her 10th board exams. The girl child should be the single girl child of her parents. Her school fee should not be more than rupees 1500 a month. While many of these programs tackle the issue of savings and education, some schemes, some welfare programs like 𝗘𝗍𝗺 𝗪𝗧 also aim to educate adolescent girls about the importance of health care. Adolescent girls get access to current and updated healthcare initiatives and learn about good hygiene. As future mothers to be, knowing about 13 life-saving vaccines that the government provides free of cost and the importance of MMR, polio and similar vaccination is integral to their health and reducing child mortality through vaccine preventable diseases in the future. Let us now have a quick look at child related schemes. It includes midday meal scheme, Sarva Shiksha Abhiyan, Operation Blackboard, integrated program for street children, Kishori Shakti Yojana, wheat based nutrition program for adolescent girls which is NPAG, Rajiv Gandhi National Creche Scheme for children of working mothers, 𝗧𝗦𝗔𝗧 𝗧𝗦𝗔𝗧, initiatives to combat trafficking of women and children, Central Adoption Resource Agency CARA, Shishu Graha Scheme, Child Line Services, Reproductive and Child Health Program. We also have schemes for working children in need of care and protection, National Child Labour Project. Let us now have a quick look at the state level welfare schemes for children with supplementary nutrition program. Like under supplementary nutrition program SNP, ready to eat food is provided to 7 months to 3 years children and hot cooked food is provided to 3 to 6 years children in all 149 ICDS projects. The Kishori Shakti Yojana scheme aims at empowering adolescent girls in the age group of 11 to 18 years by breaking the intercycle of nutritional and gender disadvantages and providing a supportive environment for self-development. The main focus is on nutrition, health, education, skill development and training on home-based skills, life skills and vocational skills. As we have discussed about integrated child protection scheme, it is a central government scheme, but it is implemented by the state government and it provides preventive, statutory care and rehabilitation services to vulnerable children, including those from potentially vulnerable families and families at risk, children of socially excluded groups like migrant families, families living in extreme poverty, scheduled castes, scheduled tribes and OBC families subjected to or affected by discrimination, minorities, children infected and or affected by HIV/AIDS orphans, child drug abusers, children of substance abusers, child beggars, trafficked or sexually exploited children, children of prisoners, street and working children. The state governments also provides for juvenile welfare. Juvenile welfare is addressed through education and focused institutional and non-institutional services. Vocational training is an important part under this program. There are 2 children homes, 3 observation homes, 1 special home and 1 home exclusively for the girls and 1 after care home in the Telangana state. The non-institutional services are extended through 𝗂𝗏, adolescent counseling and guidance clinics. These services include psychological and health related awareness, counseling and guidance services to the children and adolescents. We have a very wonderful scheme called as 𝗧𝗦𝗔𝗧. It is the weaning food introduced under ICDS to provide improved supplementary nutrition to children between 7 months to 3 years. The weaning food is a preparation of wheat, chana dal, milk powder, oil and sugar. It is fortified and thus provides 50% of iron, calcium, vitamins and other RDA that children require per day. The recommended quantity is 100 grams which is to be given to children 3 to 5 times every day. For children below 1 year, 𝗧𝗦𝗔𝗧 can be served as a porridge mixed with hot water and for older children it can be given in the form of a laddu. 𝗧𝗦𝗔𝗧 is distributed in packets of 2.5 kg per child per month. It is distributed on first day of every month on Nutrition Health Day 1 to mothers of 7 months to 3 years children as take home ration. 𝗧𝗦𝗔𝗧 serves not only as a weaning food but also has a caloric dense food to reduce malnutrition and is therefore used as part of supervised feeding for malnourished children. Friends, let us now summarize this lesson. Women and child welfare is one of the most critical aspects of development of any society. In India, several constitutional safeguards have been provided for the benefit of women and children, which we have discussed in this lesson. These safeguards are also reflected and supported through various national and state level welfare measures. These measures keep on evolving, keeping in view the changing needs of women and children. Thank you.